Learning lung ultrasound can be intimidating, but it's also an incredibly powerful tool that can be easy to pick up and use at the bedside. Want to exclude a pneumothorax with 100% specificity in a matter of seconds? By confirming the presence of lung sliding, you can. And in this video, we'll look at what lung sliding is and how to make sense of it. I'm Dr. Alex Estelle, and this is SonoCare. Lung sliding is exactly what it sounds like. We're looking at the lining of the lung, the pleura, sliding against the chest wall. Lung sliding is a good thing. It's what we want to see as it tells us the lung is appropriately inflated, and it rules out a pleural pathology at that location. It's important to note that we're only looking at one part of the lung. So the presence of lung sliding does not exclude a pleural pathology elsewhere in the chest. Lung sliding, when present, is usually quite easy to see. It's sometimes described as ants marching along a log or a shimmering of the pleura. The pleural line is the brightest horizontal line seen just below the ribs. If you're having trouble seeing the pleural line, try tilting your probe to become perpendicular to the pleural surface, which may be in a different alignment than the chest wall. By becoming perpendicular to the pleural surface, you increase the reflection of ultrasound waves back to the probe, which makes the pleural line appear brighter. If you're scanning an awake patient, having them take a deep breath in will enhance the visual appearance of the pleural line and can be a helpful trick. You can use any probe to assess the pleural line, and I usually stick with a curvilinear, sometimes called abdominal probe, on an abdominal preset, as this provides the widest field of view, as well as adequate depth to complete a full lung exam. If I'm having trouble seeing pleural sliding, I decrease the depth, which enhances the quality of the image as well as enlarges the pleural line on the screen. If that doesn't do it, I switch to using a linear probe for higher resolution imaging so I can take a close look at the pleura to assess for sliding. Here are a couple of images I've captured of normal pleural sliding, where we can see the two layers of pleura sliding against one another just below the ribs. For now, keep your eye focused on the pleural line and don't worry about the artifacts you see below the pleural line. We'll cover them in another video. Here's an example of a pleural line without sliding. Here we see the bright horizontal pleural line as we expect, but no movement or shimmering with time. This patient was being ventilated while I captured the image, so I would have expected to see sliding. In fact, this is what the left side looked like, with sliding. This patient had a pneumothorax on the right side that explained the lack of lung sliding. Now, while a pneumothorax is the most important diagnosis to consider with absent lung sliding, it's certainly not the only cause. There are many conditions that can cause the two layers of pleura to be stuck together, and in those cases, you won't see lung sliding. If the patient has a history of adhesion, say from prior infection, from radiation therapy, from a chemical pleurodesis, you won't see sliding. Similarly, if the area of lung you're looking at isn't being ventilated, either from lung collapse or maybe hyperinflation, a main stem intubation, or if the patient just isn't breathing, you won't see sliding. Ultrasound is exceptional at ruling out a pneumothorax, but is much less capable of ruling in a pneumothorax. A lung point is the term given to the edge of where the lung remains in contact with the chest wall. It is described as having pleural sliding on one side of an image and absent on another. Given that you have to line up the probe with the edge of the pneumothorax wherever it may be in the chest, this can be very challenging to reliably accomplish. But if you are able to find a lung point, you've likely made your diagnosis without needing to move to another imaging modality. This is great for both you and your patient. Sometimes it can be challenging to determine whether the pleura is sliding, even if you switch to using a linear transducer and have zoomed in on the pleural line. Two other signs that the pleural surfaces are in contact are the lung pulse and the presence of B-lines. Lung pulse is the force transmitted with each contraction of the heart at the level of the pleural surface. Here we don't clearly see lung sliding, but we do see the movement of the pleura with each heartbeat. Here we see a number of vertical artifacts that originate at the pleura. These are called B-lines, and we'll explore these in another video. The reason I mention them now is that pleural contact is required for their generation, so if you have B-lines, you can be sure that you don't have a pneumothorax. Once you've assessed an image for lung sliding, you're ready to examine the patterns that are generated in the rest of the image. We'll examine those patterns in future videos. I hope you found this video helpful. Now get out there and scan.